I'm also joined by the Honorable Dr. Hetty Fry, who of course is the longest serving female member of Parliament, currently serving the House of Commons, but more importantly, for today, she also represents 5,567 individuals who now have access to dental care through the Canada Dental Care Program. In fact, myself, if you go through the riding of Burnaby North Seymour, 1 in 20 individuals now qualify and have a physical dental membership card for the Canada Dental Plan. And more people are signing up at Canada.ca/dental every single day. In December, if I can take you for a second, way back to December of 2023, we announced that we would be implementing the largest benefit in Canadian history, accessible to 9 million Canadians. Today, 2.77 million Canadians have dental care under this program. That includes 362,950 right here in the province of British Columbia. In May, at 7:30 a.m. in Newfoundland, the first individual got actual dental care through this program. That payment was processed in less than 24 hours, but today, a mere 6 months later, over 1 million Canadians have seen an oral health care professional through the Canada Dental Benefit Program. In fact, the latest numbers I have as of yesterday is 1,040,000, although that number has certainly gone up as people have been visiting the dentist all day long. I also want to take this opportunity to thank the 22,340 oral healthcare professionals who are helping to make the Canada Dental Care Program a success. 3,228 of those individuals operate right here in British Columbia, including my dentist. I'd also like to give another special shout out to the 114 independent practicing hygienists, and growing, by the way, who are also contributing significantly to the success of the dental care program. When we started, we targeted the 85% of dental care providers who had the ability to process claims electronically. Today, I'm happy to say that 89% of providers are participating. That means that we actually surpassed the theoretical maximum, and that some providers actually started processing electronically just so that they could access this program. So far, the Canadians that are directly benefiting through this program include seniors over the age of 65, adults with a disability tax credit certificate, and children under the age of 18. Starting in 2025, which is getting closer every single day, we will onboard our largest cohort yet. That is adults between the ages of 18 to 64, and that represents 4.1 million additional Canadians that will be able to access the benefit. That is incredible. At a time when the Conservatives are trying to convince Canadians that their country is broken, we are delivering real solutions to Canadian families. When we knock on doors, we know that affordability and cost of living is the #1 issue. That's why we are so pleased to see the Governor of the Bank of Canada state that while global inflation persists, Canada is now in a low inflationary environment. That allowed the bank to cut interest rates by 0.5 point. That has immediate consequences to families that we represent, representing hundreds of dollars in savings for many. It also unlocks the business case for tens of thousands of more units of housing across Canada, which helps put downward pressure on rent. And as we have seen recently, rent has been decreasing in our metro areas, including in Metro Vancouver. It's also promising that wage growth has now surpassed inflation for 19 months straight in Canada, which means that working Canadians are getting further ahead. But let's not forget the value of today's announcement in the context of our government's fight to make life more affordable for Canadians. For each of these million people, 1,040,000 to be exact, more as of this morning, the average saving per individual is $730. For a family of 4, that represents thousands of dollars in savings. This is alongside other programs like pharmacare, like the $200 billion investment in healthcare, like childcare, like the school food program, and like other investments in retirement security, all of which are working together to lower the cost of living. Not to mention unprecedented investments in building more housing and immigration changes that will allow us to slow our population growth while growing our economy and allowing our housing supply to catch up to demand. But guess what? I'm not here just to talk about the things that we're already doing. I'm here to say that we're going to do more. Starting today, Canadians can start accessing more complex procedures that require pre-authorization. So this was supposed to start as of November 1st. Today is November 1st, so that means that certain procedures around dentures, crowns, more complicated surgical procedures, and procedures requiring sedation are now accessible through the Canada Dental Care Plan. Each will be handled on a case-by-case basis, and as with the entire program, it is based entirely on medical need. I'm also excited to announce that in addition to electronic claims, we will begin to process paper claims as well. So you'll remember before when I talked about the 89% of oral health care providers that are now participating in the program. Well, that's not good enough. We want everybody to be participating in the program, and this is going to allow those other providers to be able to come on board so that Canadians can access the dental care that they need and that they deserve from wherever they are in Canada and however their healthcare provider is providing those services. I also want to give a shout out to the Minister of Health here. I have worked hard over the last number of years to make sure that the enrollment process is as seamless as it can possibly be. The Minister of Health has been working with dental providers to make sure that all of their concerns, whether it be processing or the like, are taken care of so that this program is easy to administer on the ground when providing these services. Finally, I think I want to spend some time talking about what the Minister of Health talked about yesterday, which was the actual impact of this program. I already said that the average Canadian is saving $730 on average when accessing this program per visit. The healthcare system is saving too. Emergency room oral health costs us $1.8 billion a year. There are other related oral health costs that are being saved within the health system. Dental surgeries, as an example, under sedation account for 1/3 of all day surgeries for children ages 1 to 5 at children's hospitals. 70% of chronic disease in Canada is preventable. We have to stop looking at these investments in healthcare solely as costs. It is an investment in good health, in productivity, and in the future of our economy. It's one of those amazing things where it really is. It's the morally right thing to do, but it is also the economic smart thing to do. So when you catch oral cancer early, and there's many cases of this that have happened over the last 6 months, it is treatable in a lot of cases. These dental visits are also saving lives. So if you are 1 out of 4 Canadians who qualifies for this program, I encourage you to visit Canada.ca/dental and sign up. We all deserve access to universal health care, and oral health care is health care. And under our government, it is here to stay. Thank you very much.